Orion, I didn't prepare like a PowerPoint presentation because I really like to be as dynamic and just be able to see you guys and hear from your guys' experiences. But Orion has been providing home and community-based services for over 15 years. And we just opened our ABA program almost 6 years ago now. Holy cow. So 6 years ago, which is crazy. And so we provide all home-based services. And then 2 years ago, we started our clinic. So we have one clinic in Chandler that's on Dobson and Elliott, and Bailey is our clinical program director for the clinic. So I'll tell you guys a little bit about our home sessions, or our home services, and then she'll kind of fill you guys in about our clinic-based services. So we provide early services along with, others and whatnot through our insurance model, primarily early intervention through the state program, which we know is kind of going through some shifts. So we're working through that model, but the bulk of our patients. Now we have about 300 members across the valley. We service all over the place. So we're in Gilbert, we're in Goodyear, we're in Peoria, we're in Anthem, Maricopa, all over the place. And so, hi Tristan, we just got started, so I'm just gonna keep going. And so, like I said, our primary solution is early intervention, but we do have other kiddos now that we're opening up our insurance-based model for other kiddos, which is really exciting. So now we're starting to get some of the older kiddos, 9, 10, we've got a couple in their teens, which is really my passion. I love the little bit older kiddos to work with, but obviously not discounting the early importance of that. So something that we really take a lot of pride in is our collaborative efforts through first supervision, along with other community outreach things. So I am actually the leader of the ABA SIG group, Expanding the Scope. So in that group, we do a lot of work with looking at how BCBAs can be utilized outside of just the field of autism. So we talk about health, sport, fitness, we talk about behavioral gerontology, we talk about ACT, all kinds of crazy stuff that's super fun and just kind of gets you outside of box and thinking, how can we expand our reach as behavior analysts. As far as supervision, the model that we take is generally you'll have at least 2 supervisors. So we never put one supervised BA because I'll be the first to tell everyone that I don't know everything. And I know that there are others that are really great at certain things that I'm not either, or that I don't really love to do. So really partner together at our agency to make sure that you're well-rounded as far as what your expectations are for direct work and then your work and all of that good stuff. So I don't know, it's pretty, we like to, do a lot of team building stuff, and we do have some other internal activities. So we have an internal ACT SIG, so we meet once a month and we do some work with ACT and how we can incorporate that into parent training and development. So that's really fun. As far as expectations and what it probably be able to expect from us is your direct work would be probably with an in-home early intervention kiddo, just because that's the bulk of our patients. But if there is something that you're passionate about, we always take that into consideration. We want, your needs to be met as well. So if it's something that can work within the schedule, we're flexible with that. So we do have a structured supervision curriculum that we use. So we go through all 28 tabs of the binder with all of the fun work, but it's we really want to make sure that you guys meet all the standards and all that good stuff. So I'm gonna let Bailey talk just a little bit about our clinic since she runs that. You guys can hear all the fun stuff she does there.
Thanks, Kayla. Yeah, so like Kayla said, our clinic is in Chandler off of Dobson Elliott. We are kind of a smaller clinic than a lot of other agencies around the valley. I'm the only BCBA there that's doing supervision of our clients. And so our ratios, our client ratio is, I think we have 8 kiddos at the clinic. So it's smaller, so you guys get a lot of my attention. The RBTs have, you know, my supervision at all times because I'm always there, which is really great for them. Our primary model there is the insurance model, so we don't have any of our state kiddos in there. And it's really nice. Like all of our RBTs are really close. You get that, you know, in-person adult contact a lot, which is awesome. And it's mostly geared toward that early intervention. So I think youngest 2 years to, I think our oldest is 11. So all younger kiddos, it's set up for that way. We have different areas in the clinic where it's like the playroom and the gross motor room, and we have snacks, and we do a calendar time. So it's really set up for that younger population. I think that's everything.
Perfect. Thank you.
Yeah.
We do have a little bit smaller group, so I'm just going to open it up to any questions that you guys have. So you can ask away if there's anything that you guys have on your list that you want to know about us that we didn't answer. Feel free to ask.
Sorry, I had to unmute it. I forgot where the button was at. I was like, where'd it go? Okay. So I am wondering, so you said that supervision, that you use a binder, like a task list binder, is that what it is? What does that look like? Are we doing quite a bit of direct care, or how are you balancing both sides of our hours that we need?
Yeah. So I wish I had our binder here, but it's essentially 2 huge stacks of all of the resources that we've accumulated through all of our work with supervision. So what we do is we go through and we'll look at the task list and we'll talk about kind of where you're comfortable. I'm sure you guys have done those scales of like, I'm a 0, I'm a 3, I'm super proficient. So we kind of define where you guys are at. If you're second, we say, okay, you've had a lot of practice in this. We don't need to talk anymore the pre-mac principle. We can move on to some other things. But we'll deliver that in a BST model. So we go through the instruction where we'll give you content to do for your indirect hours, research, program design. We'll watch you do it, role play with you, and then we'll give you feedback on it. So we go through that kind of every component that's feasible to use that model for. We'll do like mock FBAs. If you don't have a patient that really needs one, we'll give you kind of scenarios. We do a lot of ethics work. So our chief clinical director is actually the committee chair for ethics committee for ASIABA. So we do a lot of ethics. We highlight participation in that type of stuff. So that's really what it is. We'll assign you the work, or we'll say, where do you guys feel like you're really having a lot of issues? What are you not getting? So we're pretty flexible at where we don't necessarily start in tab 1 and go all the way through 28. We'll say, okay, we have a client that really needs some, is just starting the man training program. So let's jump into tab 14 or 15B and go through that. So that's what it looks like recommended articles and that type of stuff for your indirect, and then your direct is actually implementation.
I have more. Tristan, do you want a turn? Do you have any questions? Because I will just keep going. No?
Did that answer your question? I know it's like,
thank you.
Usually we have all the stuff, to be like, this is what it looks like, but I'm just using my best verbal skills to try to explain it.
I know. Okay. It's weird. Everyone's home. Like, I never thought I would be sitting on a couch doing that. Like, hey.
Yeah, for sure.
So, in regards to that, what kind of assessments do you do? Do we have opportunities to run FBAs or FAs? What are you doing in terms of all of that?
Yeah, so Bailey is actually our peak expert. So she does a lot of peak work with her kiddos at the clinic. We do that with any child that it's appropriate with, but the majority of the are Vinelands, the VB map, some ABLES, but not quite as much. We're definitely more proficient with the VB map and the usability and functionality of that. We do FBAs for patients who require it. Like I said, most of them are littles, so don't necessarily need to take that route right away, but when we do, we definitely do. Really, 2 kiddos with FBAs right now at the clinic. So we do them. FAs are a little bit challenging to run in the home environment because you really can't control for all of those variables very well. But we always do mock ones. So if it's something that we can't easily replicate or do with a patient, we'll give you opportunities to at least practice them. And so I think all of our supervisees have always, I think the one that we have now, we've put her through everything. So she's actually had to run parts of the VMAP, she's had to score it, she has to score the Vineland, she's given it to us, as a parent, she sits in on the parent assessments and all of that good stuff. So yeah.
I have another one, like one more. So how many hours are you looking for us to be working with you per week?
That's really kind of flexible based on requirements that you guys need to fulfill your hours. So we can give you as much indirect work as you need per week, and then, obviously matched with your direct work. So typically, like I said, we're really flexible as far as our requirement schedule. There are some weeks where I'm like, hey, let's do 3 hours on Monday. We got a lot of stuff to talk about, so that will cover us for 2 weeks. There might be sometimes I'm like, I only have 30 minutes between this week and next week, so let's hop on and we'll schedule this week. So we're pretty fun. We know everybody has crazy busy lives. We have crazy busy lives. So, our biggest ask is just communication. So like if you've got a super stressful week, finals or whatever, and you're like, I have no time for direct contact this week. Great. I probably won't either. So let's schedule double next week. And, we're pretty flexible with that.
Great. Thank you.
Yeah.
That's all of my questions.
And then, okay, perfect. We also do, if something comes up where you guys are kind of, you're always in there. We're like, oh, I have a parent today. This is going to be a tough one. I'm going to see if we can get an ROI and have you guys jump in. So there's always these unique opportunities where, it might be, this might be out of the way, but there's a really cool assessment going on 30 minutes at the house, come if you can. So we try to make those opportunities available as they come in. It doesn't always work out perfectly where, you're learning about something and we can say, oh, we have somebody that's doing this right now, but we try our best to give you guys those opportunities as they come up. Bailey, anything else that you'd like to add?
I don't think so. I think you covered a good portion of what we do, especially within supervision. I think having the 2 supervisors is huge for you guys because you guys get to see so many different tactics and having that flexibility. It's, I went through supervision with Arion, so I'm a little biased probably, but we're just really great. So yeah.
That's the other thing I guess I'll just plug a little bit is we really will put in as much as you guys will put in because we'd love for you to be able to stay and have a job once you're done. So that's, what we put into you guys is what we hope to get in the field. So it's really important for you guys to be well trained and have all those experiences. So, yeah, that's just my little plug is we're always looking for new BCBAs after supervision. So, or new BCBAs in general. So we get a lot out of it for putting a lot of it into you guys. So it's a great trade-off. Yeah.
Yeah, of course.
Tristan, did you have any questions?
No, Candace asked pretty much a lot of them that I was going to ask regarding like opportunities to run like assessments and FAs and stuff like that. So I thought you guys described that very well, and that's really cool.
Perfect.
Thank you.
If you guys don't have any questions, you can have a 3-minute break before your next, I think maybe there's 5 minutes in between, so you can get 8 minutes. You can have a snack.
Coffee refill.
Yeah, coffee refill. There you go.
Thank you.
Yeah, absolutely. Thanks, guys.
Bye.
You too.
Thank you so much.
Welcome.
Like I
Bye.
said, I'll share contact information after. So thank you again. We appreciate it.
Yep, absolutely.
All right.
No problem.
Bye.